Can a type 1 diabetic use metformin to improve glucose levels? Why it came to my mind is that even though I was diagnosed as type 2 diabetic 40 years ago, my insulin production and C-peptide levels have reached the levels of type 1. There is a link to research articles in the description page. Do you have a similar experience with blood sugar control? It is a complex question with no simple yes or no answer. If you find this video is too slow, you can click the gear icon and increase the speed. Also, you can set the subtitles in your language. Here's what you need to know. Please remember that I am not a medical professional and this should not be considered as personal medical advice. This is my personal story and what I learned through 40 years of diabetes. Always consult your healthcare professional before making any changes to your medication or lifestyle. Metformin is primarily used for type 2 diabetes. It works by helping your body use insulin more effectively and by decreasing the amount of glucose produced by your liver. But the common view is, in type 1 diabetes, the body doesn't produce enough insulin on its own. How much insulin you need depends on the type of food you are eating. While not formally recommended, metformin may be used off-label in some cases of type 1 diabetes. Some research suggests it may offer benefits such as improved insulin sensitivity. This could potentially lead to lower insulin doses and better overall glycemic control. There is a research article on PubMed, which says, in conclusion, metformin decreased glucose concentrations in the blood. It also reduced metabolic syndrome, as well as insulin dose requirement, which is very important consideration with respect to cost and inconvenience of injections. These results were independent of blood lipid improvement or weight loss, although on average weight decreased with metformin insulin therapy. Average weight increased with insulin therapy alone compared to therapy in combination with insulin. I will have links in the description. Weight management. If you're overweight or obese, metformin may help you lose weight, which can further improve your blood sugar control. Reduced cardiovascular risk. Some studies suggest metformin may have cardiovascular benefits in people with type 1 diabetes. However, there are also important considerations. Research on the use of metformin in type 1 diabetes is less extensive than in type 2 diabetes. Metformin can cause minor side effects like nausea, diarrhea, and stomach upset, especially when starting the medication on higher doses. But to my knowledge, they are not life-threatening. Discuss with your doctor. Increased risk of lactic acidosis. This is a rare but serious complication that can occur with metformin if you have certain kidney or liver problems. Ultimately, the decision of whether or not to use metformin for type 1 diabetes should be made in consultation with your doctor. They will consider your individual circumstances, including your overall health, weight, and how well your diabetes is currently controlled. Up above you see a video related to type 1 diabetes and insulin production. I am sure that will be helpful information. Do not forget to click the like button and subscribe. Thanks very much for watching this video. It will be more helpful to you and your family. Subscribe to my channel. See you in the next video.